In the consent form, it explicitly states, quote, "The case supervisor will determine the time period in which I will remain isolated according to the beliefs and practices of the Scientology religion. I further specifically acknowledge that the duration of any such isolation is uncertain, determined only by my spiritual condition, but that such duration will be completely at the discretion of the case supervisor." So with the introspection rundown, looking at this material, we have an acknowledgement that those who are suffering from psychotic symptoms may pose a direct or indirect threat to themselves or to others. That such a person must be isolated and managed for his own and for others' protection. That when that person is isolated and undergoing the IR, he or she does not have a choice to continue with the treatment or not. Its nature and duration, once started, is solely at the discretion of the case supervisor. The consent form for the IR is presented and signed before anyone actually is psychotic. This is something that is signed early on. It is not something that someone who needs to do an IR like this minute, or they're talking about psychotic symptoms, yesterday or today, will sign. But this is something that is done ahead of time. So it's basically a blanket consent for treatment or for management of a condition that has not yet arisen. So basically, by signing it, you are signing away your rights ahead of time when the nature of such a decision or the consequences of such a decision is far more difficult to appreciate. And this consent form that is used does not come close to providing informed consent. Nowhere on that form does it say, for example, that most other people in society, most other groups in society, most other professional organizations in society see a psychotic break as a medical or psychiatric problem or emergency. So you're not informed that, well, some people see it as a spiritual issue, other people see it as a medical issue. There's no discussion of the risks of untreated psychosis or the natural progression of an untreated or poorly treated psychotic break. There's no discussion of the medical or the psychiatric options versus the introspection rundown options. So that's not informed consent that you can compare choices. And there's also no discussion of the side effects or potential side effects of the introspection rundown protocol, which again may include isolation, may include high doses of vitamins, may include all sorts of potentially medically destabilizing things happening. So we would, getting back to Dr. Szasz, we would challenge Dr. Thomas Szasz right now to identify any meaningful way that the introspection rundown of Scientology differs morally from traditional coercive psychiatric practice. We would ask him why he has given his support, legitimacy, and sustenance to this organization for over 40 years. When this policy has been on the book, this IR policy has been on the books and has been very publicly practiced by Scientology for many, many years. We finally call on Dr. Szasz before his death to renounce Scientology institutional practices, including the IR, that are obviously and grossly contradictory to the very core, the very essence of Szasz's own beliefs and intellectual efforts for the past 70 years. He cannot believe what he believes and not denounce Scientology for the exact same reasons as he has denounced psychiatry. Wrapping this conversation up, the issue of the introspection rundown is not some theoretical or esoteric concept. The consent form that I've quoted from, that we've been talking about, has actually been dubbed by some as the Lisa Clause. And this is named after Lisa McPherson, who was a young Scientologist who died in 1995 after undergoing the introspection rundown through Scientology in Clearwater, Florida for 17 days. At the time of her death, Lisa was gaunt, bruised, unkempt, dehydrated, and septic. She apparently later succumbed to a pulmonary embolism or a blood clot in her lungs. The civil case in Lisa's death was only settled in 2004, nearly a decade after she passed away. This is a real issue. There are other reports that are coming out and other documentation of psychotic symptoms and psychotic breaks and serious psychiatric compromise being, quote, handled within Scientology and made grossly worse by Scientology practice. Again, I would refer you to My Billion-Year Contract by Nancy Meny, who writes incredibly powerfully of undergoing a period of psychosis within the Church of Scientology and how that was managed and how she was harmed, basically, by what these practices were. I would also point out another small book, but very interesting book by Aaron Gottfried. And the title of this book is The Psychiatrist Who Cured the Scientologist. And this is, again, Mr. Gottfried's descent into bipolar mood disorder within the context of his being managed and treated and supervised by Scientology. Again, it's a very, very distressing and disturbing thing to read. And I would encourage people to look at that.